Sarah Michael. I'm a consultant psychiatrist at St Vincent's. I work on the inpatient ward and also in the community setting. Psychosis is a bit of an umbrella term, and it really describes a cluster of symptoms. So we talk about people experiencing hallucinations. So a really common one is when people talk about hearing voices, but they could also see things or feel things on their skin or feel things within their body. We talk about delusions. So again, a really common one is people experiencing paranoia, and certainly over the last 10 years we've seen an increase in people experiencing paranoia around social media or their phones or the internet. But you can have delusions around a number of things, around your body, around your thoughts, around sort of other bizarre things or things happening out in the world, and those are really just things that you believe to be true which aren't based in reality. And finally, we can also experience thought disorder, and so this again might be when people are talking but just not making a lot of sense. So that is psychosis. There are lots of different types of psychosis. People can experience a brief reactive psychosis, which is probably the shortest one. It might come on after a period of stress or not sleeping. People can have a drug-induced psychosis, which might occur after they've taken certain drugs. We can see psychosis as part of schizophrenia, bipolar, even as part of a severe depression. We can see postpartum psychosis in people that have just given birth, and that might be symptomatic of a more serious illness. And we can even see an organic psychosis where people have an untreated medical condition that's presenting with psychosis. I think one of the biggest myths around psychosis is that people believe people experiencing psychosis are more at risk of being violent to others. And actually there are longer term studies that show it's just not the case, and that people experiencing psychosis are just as much a risk as anyone else in the population. And in fact, what these studies do show us is that if anything, people experiencing psychosis themselves are more at risk of being a victim of violence.